While the country's ban on alcohol sales partially relaxed, the sale of tobacco products still not allowed. As soon as the sale of alcohol was allowed, hospitals recorded an increase in the number of trauma patients coming in. 3 organizations, Sonke Gender Justice, Gun Free South Africa and the Southern African Alcohol Policy Alliance, held a webinar yesterday to discuss the possibility of lobbying for alcohol availability to be permanently reduced. This as a means to prevent alcohol-related harm. Well, for more on this, we join via Skype by the regional coordinator of the Southern African Alcohol Policy Alliance in South Africa, Adila Maker. Adila, good morning and thank you very much for your time. Well, alcohol sales are happening, but places like Gauteng are reviewing to say what do they do, but it seems like we're not going to go back to the days of a full ban that we saw under level 5 and level 4. How do you respond to that?
Well, thank you for having us. I think that the first thing to acknowledge is that government as duty bearers have the task of promoting and protecting public health. So when they imposed the ban on alcohol sales, not alcohol drinking, but alcohol sales, for them that was a containment measure. For 2 reasons. One, we've got a drinking culture in South Africa where despite the fact that only 31% of the population 15 and above drinks alcohol, almost 60%, 59% of those they do drink heavily. And when they drink, so heavy drinking basically means that people drink not to socialize, but to get drunk. And with that goes a culture of sharing glasses and bottles. So that was the one reason. The second reason was that of health resources, is how do we look at preparing the health infrastructure to cope with COVID. And that was based on the fact that when people drink alcohol in South Africa, we have 171 people pre-COVID that died every day due to alcohol-related harm. And what COVID has done is given us a natural experiment where we've seen what's the rates pre-COVID. We've seen what's the rates when government imposed the ban, and we saw that hospital admissions that dealt with alcohol-related harm dropped with 60%. We saw that contact crime dropped with almost 60%. So rape, murder, assault dropped with 60%.
And I'm sure any society would welcome such a drop because, I mean, the numbers are really horrendous. Would you still be advocating for a ban on alcohol sales across the country? Because for the last 100 days, we're looking back now, it seems from what you've just said, it benefited us as a society to have banned the sales of alcohol.
Well, I think that the learnings of this period is that we need to look at better regulation and enforcement of alcohol trade. So we're not saying that we should go to banning the sale of alcohol, but let's look at how do we ensure that we have better regulations and better enforcement.
Would you keep Monday to Thursday 8 to 5 sales, or would you recommend that even that should be regulated differently? We reduce the number of days when we can buy alcohol.
Well, I mean, we think that it's adequate. We wouldn't necessarily say we should reduce the number of days, but what was key is that we limited the sales days and excluded the days of Friday, Saturday, and Sunday, which is often related to alcohol-related harm. So the police stats will show you that there's an increase in harm when Friday, Saturday, Sunday kicks in. So that's the one thing. The second thing is that the hours of sale. So looking at 9 to 5, we currently have sales hours of consumption that sometimes goes up to 6. At some places it's later, depending on the licensing conditions. And then we have on-consumption licenses where people are able to drink till 2, 4 o'clock in the morning. So that is key. If we look at what happened in Russia, what they did is they looked at reducing the number of hours, the opening and closing hours of sale. They also introduced a tracking system. And what is in South Africa a particular problem is that we have a very large percentage of alcohol outlets that is unlicensed and unregulated. But they, according to statistics or according to research, show that almost 70 to 80% of SAB sales is through the unlicensed sector. So what is it that we should be doing to hold the alcohol industry more accountable? And one of the things that Russia did is they introduced a tracking mechanism. So at the point of alcohol production to the point of sale, you are able to track what's the journey of the alcohol.
I hear the very, very interesting points there. Monday to Thursday, it's one of the things, more regulation and maybe tracking the sales. Thank you very much, Adila Maika from Southern African Alcohol Policy Alliance in South Africa.